All right, it's
Hi.
almost time to get started. Welcome, everybody.
Hello.
Welcome to our transition booster session this evening. This session is titled Transitioning to Adult-Centered Medical Care. This is our first webinar of 2021. We have more coming up the rest of the year. We hope you'll check it out. As we're still letting more people in, I'll go over some housekeeping tips. Please keep your video functions off for this evening. We have a large group. We want to make sure that the speaker's information is available to be heard by everyone. And your microphones, please keep muted as well. Throughout the presentation, I'll try to help you do that as well. Sometimes those buttons get hit by accident. Also, we ask you to use the chat box for any questions throughout the presentation. We have chat box monitors helping tonight, monitoring your questions, and we will answer them or try to do our best answering them at the end of the presentation. So again, welcome everyone. I'm still letting people in here tonight, which is great. My name is Amy Clausen, and I am the Northern Ohio Family Specialist with Family to Family Health Information Center. Ohio Family to Family is housed at the University of Cincinnati Center for Excellence in Developmental Disabilities, and we sit within Cincinnati Children's Hospital Medical Center. Today's webinar, as I said earlier, is Transitioning to Adult-Centered Care. This webinar is information for families and caregivers who have youth with special needs and professionals who support them. I want to give a particular shout out to all of our partners who help bring the transition booster sessions to fruition here this evening, particularly livespecial.com, the Upside of Downs, Summit County, Medina County, Portage County, and Cuyahoga County Boards of Developmental Disabilities, Milestones Autism Resources, the Autism Society of Greater Cleveland, and Friendship Circle. We can't do it alone. I love all of the partners we have. They're wonderful. Please check them out, give them a call, email them. We're all in this together. And on that note too, I want to also say we've been working hard through COVID and through the winter to come up with some very important transition boosters this year. Our next one is April 29th on trusts and stable accounts with Derek Graham, who's an attorney and a dad, I might note, of a child with special needs. Please check it out and get registered today. And so, without further ado, I just want to give a very big thank you to all of our three speakers here this evening. They're such experts and care passionately for their work and for their patients and families. Erica Kraft is a PhD. She's a pediatric neuropsychologist with Akron Children's Hospital. Julie Corder is a RN, MSN, and nurse practitioner at Cleveland Clinic. And her colleague, Carrie Cuomo, is also a nurse practitioner, and they both work out of the Pediatric Complex Care Clinic at Cleveland Clinic. We're very proud to have them here with us tonight, and we're honored. And without further ado, I'm going to give the mic over to Erica. Thank you, Erica.
You're welcome. I am going to try to share my slides. Amy, are those visible? Yeah, okay. All right. So as Amy mentioned, tonight we're going to spend some time talking about the process of transitioning to adult-centered medical care. My role at Akron Children's Hospital is that I'm a pediatric neuropsychologist, and I work with a lot of families that have complex medical needs along with different cognitive difficulties that sometimes make that process challenging. And so tonight we really want to spend some time talking about why it's important to transition to adult-centered care, some of the barriers that exist that make this overwhelming or scary at times, and some concrete steps that you can take to really make the transition process a little easier. And then right at the end, I'm going to go over a little bit of information about what's happening with transition services at Akron Children's Hospital. So one of the things that I always like to highlight when talking about transition is the difference between a healthcare transition and a healthcare transfer. A healthcare transition is the process of changing from a pediatric to adult model of care. And when we think about transition, we want that to be something that's purposeful, planned, uninterrupted, coordinated, developmentally appropriate, psychosocially sound, and comprehensive. And really our goal is to optimize health and assist youth in reaching their full potential. So thinking of ways to help make sure that there's never any gaps in care and that they're able to be met at their level in an adult setting. When we think about a healthcare transfer, this tends to be a point in time when there's a movement from clinical care from one provider to another. And often this is unplanned or unexpected. When I think about a transfer, it's often something that happens in response to crisis. And so I've occasionally heard from families that will call to make an appointment with a pediatric provider who they've seen for many years, and will suddenly find out that their child has a system. And so suddenly they're left scrambling to try to find an adult provider, and it can really create a disruption and be a scary for families to go through. So our goal is to avoid that. When we think about why it's important to transition to adult care, I think that first and foremost, it's really important to note that conditions are simply better managed by adult providers. And as our youth grow into their adult roles, they're going to be coming up against different adult conditions that might not have been risks for them when they were younger. It's also important the fact that sometimes pediatric outpatient providers may not be able to follow a patient if inpatient care is needed. And so it's really important for your child or loved one to have a provider that can meet their needs if they have to be hospitalized. It also helps to ensure that services are available for younger patients. We know that there's always going to be a new body of patients coming in, and so we want them to have access to pediatric services. And then I also think it's important to recognize that teens and young adults are moving into that role of adulthood, and moving into adult healthcare setting may help them gain efficacy and maturity. So there are definitely distinctions between pediatric and adult care. And a couple of things that are really specialized about pediatric services is that they're very family focused. Providers in pediatric settings are often really tuned with developmentally appropriate care and can kind of adjust how they talk about conditions or treatments to make sure that their patient understands. And there's significant parental involvement in decision making. And in many cases, the parent is the one that's making the decisions, maybe with some input from the child, sometimes without input. In contrast, in an adult service setting, it's going to be much more patient focused, and adult doctors are going to expect more autonomy and independence in decision making. This also means that we have to have legal things in place to allow parents and caregivers to remain involved as moving from the pediatric world to the adult world. So qualitatively, I also think that there are a lot of emotions that we have when we think about moving from a pediatric setting to an adult setting. And so I did a quick Google search, pull some images from pediatric settings and adult settings. And when you look in the top left corner, you see colorful images, lots of smiling, and my favorite are Doggy Brigade Children's Hospital, where we have dogs that come into the hospital that help patients that are going through difficult procedures, reduce anxiety. In contrast, when we see pictures from adult settings, they tend to be more neutral colors or more a little bit more stark. The faces are not always as smiling or friendly. And I know that this is a stereotype in a lot of ways. I've had a lot of adult providers that are very caring and warm, but I think the fear is that they're going to lose that connection that they have with pediatric providers when we move into the adult world. So what are some of the barriers to mind when we think about transition? I think it's really important to remember the fact that a significant number of youth have special healthcare needs. And when we look at patients between the ages of 12 and 17, 25% of them have at least one chronic health condition need to be managed in the adult world. And many of the patients and families that I see upwards of 10 to 15 providers, depending on their child's needs. Interestingly, there was a survey done, and it's been several years now, but what they found was that up to 60% of patients and families felt that they didn't get the transition services that they need to help make that transition happen. And that can really affect health outcomes, that if there's an interruption in care, we might have poor health outcomes in the long term. We really want to try to maintain services throughout. So when we're thinking about how to conceptualize these barriers, it's really important to think about all the parties involved. So the pediatric providers or doctors, the adult providers, and most importantly, the barriers that families are facing. When we talk to pediatric physicians, they talk about several different things, but I think one thing that really comes to mind is that they find it difficult to break bonds with patients and families that they've known for a long time. It's really hard to say goodbye, and it's hard to imagine a family kind of moving on to the next stage when you've been a part of their care since they were very young. Pediatric providers often have questions about where they can send their patients, and they worry about whether adult physicians will be sufficiently trained in some of these really complex childhood onset conditions. I will say across the board, when I talk to my colleagues, lack of time is the biggest barrier that is mentioned. Physicians already feel like during a medical visit, there's so much information to cover with updated symptoms, responses to medications, any upcoming treatments that they may be needed, that they feel like there's not enough time to also talk about transition. So it gets put to the back burner until we're really getting close to that age where transition is going to occur. When we talk to adult providers, they may talk about their practices already being full, not getting enough information from the pediatric providers, so feeling like there's not enough back and forth conversation or communication, having lack of experience with some of these pediatric onset conditions, and a general lack of resources. When we talk to families, they again bring up that relationship that I think when you've had a child that's been with a physician since they were very young and possibly since birth, it's really hard to imagine having to start over with someone new and having to fill them in on everything that's happened that's been complex in that child's medical care. There's also some hesitance with parents of being ready or able to relinquish decision-making responsibilities. And I also hear from a lot of families that they feel like their youth is not interested in medical transition, that their teenager has other things on their mind and they don't really want to talk or care about their medical care as much as the adults feel that they need to have a part in it. Another thing that I've heard many families mention is that they don't feel like they're getting enough information about transition from the providers that they work with, and they worry about being able to find an adult doctor, as well as insurance issues, which we'll talk a little bit about as we move through the presentation. So tonight, I want to talk about a couple of concrete steps that you can do to really help your youth be successful with healthcare transition. But one of the things that I want to highlight before we get into the nitty-gritty is really acknowledging that transition is not a one-size-fits-all process. So each family, this is going to look a little different, whether that's related to the number of doctors that your child sees or the amount of decision-making capacity that your child has. It's all going to be very individualized. So this is just a guideline and a starting point. But know that there may be some parts of what we talk about that fit really well for your family and some parts that may not be relevant. One of the pieces of feedback that I've gotten both from physicians and from families is the importance of starting this process early. One of the resources that will be mentioned at the end of the talk, and I believe Cleveland Clinic is also going to talk some about this, is an online resource called Got Transition. And it is a fantastic website that has a ton of information about healthcare transition geared both for families and for healthcare specialists. And what they really recommend is starting the process around the age of 14. So starting to have conversations, knowing that that gives us several years to really get ready for this process to happen. I will say that if you're a family that your teen or young adult is well past the age of 14, there is still time to make the transition happen and have it not be overwhelming or scary. It just may take a little bit faster pace than what we really ideally would like to have happen. And by starting early, it really helps for the organization to fall into place. And that can include things like obtaining copies of medical records, having a concise medical summary, verifying what insurance coverage is going to look like after your child turns 18, as well as when they get closer to age 26, and also thinking about what decision-making supports may be necessary. We're going to talk more in depth about the 3 bottom bullet points, but in thinking about the medical records, I know historically it's been really important for a lot of times for us to have paper or physical copies of medical records. Given the onset of electronic medical records, I really encourage you as you're starting this process to try to talk to the adult facility where you think your child or loved one will be getting care to see if their medical record communicates with the pediatric medical record. And what I mean by that is at Akron Children's, we have something called Care Everywhere that lets us communicate to Cleveland Clinic and nationwide and different organizations in our area, so that you wouldn't necessarily need paper copies of those medical records, but they might be able to just access them electronically in a very seamless way. So that's something important to kind of talk through with your current providers, as well as the future adult providers. The medical summary itself should be something that's condensed but comprehensive. So it's really that balance of having all the most critical and important information, but also being something that a new doctor can kind of look at and get a good understanding of your child or loved one's medical history. Examples of things that should be included include current diagnoses and medications, allergies, as well as procedures or things that should be avoided based on past medical experiences, prior surgeries and hospitalizations, as well as any kind of recent lab results. So things like blood work or CT scans, any of that would want to be something that's included in the health summary. Got Transition has a really nice example of this, and I will make sure that a copy of my slides is available so that you have access to all these websites. One thing in thinking about the medical summary is that this is a document that kind of grows and changes over time. And so especially if we're thinking about starting this process early, the medical summary doesn't need to be updated weekly or monthly, but ideally would be updated at least once a year. And I think encouraging families to add on anytime there's a big change in health status really helps to make the process less daunting. So if there's a big medication change or a new surgery that comes up, add that to the medical summary when it happens so that way you don't forget about those details over time. One other point that I always like to make with the medical summary piece is thinking about an emergency care plan and recognizing that some of our pediatric hospitals have age limits regarding when emergency and inpatient care can happen. So if you end up having to go to an adult facility, it's really helpful to have something portable that includes the critical components for your child's health history. A couple of options for this. Got Transition recommends a free medical ID app that's available on Apple and Android devices. I recently downloaded this to kind of play around with it. And one of the great features is that your lock screen has a little medical ID button so that if you were ever in an emergency situation and couldn't respond or explain your medical history, the emergency responder would be able to access that information on your phone without having your passcode. I found it to have not a great amount of detail. So for some of our more complex patients, it may not have enough information for those emergency situations. And in those settings, something like a MyID medical wallet ID card or a wearable bracelet that has a QR code that accesses a bigger amount of information, something like that may be helpful and important to look into. Another concept that we talk a lot about when thinking about healthcare transition is the importance of establishing a medical home. And a medical home model is really having one core person that kind of takes the lead in your healthcare from that point on. Interestingly, in a pediatric setting, the medical home often is one of our specialty care providers. So I work a lot with neurology in our division, and especially for our patients that have epilepsy, our neurologists often end up being the medical home for that patient or family, where that patient really sees their neurologist more often than they see the pediatrician. In the adult world, that often kind of shifts where the primary care doctor tends to be the person that takes that key role as the medical home or medical center, who then refers out for specialty care. And one of the nice things about the medical home model is that if we can find that core central person to take on the first role and be the first person that we transition to, the transition of additional specialty providers can then happen in a gradual fashion. So I really think it's important to know that on Friday, you don't have to see all pediatric providers, and by Monday, have all adult providers, but that it can be more gradual than that to make it easier for you to develop relationships with new physicians and to kind of help make the process more manageable. I also think that at times it can be challenging for our pediatric providers, specialty physicians in the area that can take on that role. And so by having an adult primary care physician who has some of those relationships, it may be easier for them to find a gastroenterologist or an endocrinologist to kind of round out your child or loved one's care. So this slide is something that I feel is really important, but also is one of the aspects of transition that is going to be very individual, different for each family. I work with a lot of families who have teens and young adults who are nonverbal or have really significant cognitive disabilities that make it hard for them to actively participate in their care. So there are some patients that this won't be applicable for. But I do believe that for a lot of teens and young adults, it's really important for us to have conversations with them to start to understand what they know and what they understand about their own medical care. So questions about, do they know their current diagnoses? Do they know the names and doses of their medications that they're taking? A question that I think most 18-year-olds does not know anything about is insurance. So that's something that we have to have conversations about to really educate teens and young adults so that they understand a little bit more about the ins and outs of the healthcare setting. Once we know what your teen and young adult is aware of or knowledgeable about, that can help us identify next steps for skills to work with them on. One thing that I think can be really for a parent or caregiver is having teen or young adult meet with their provider alone. And again, in some families, this may not be a possibility, but I think it's a great step for really building that self-efficacy and helping teens and young adults to feel like they're starting to take some ownership in their care. Have your teen or young adult ask questions and provide information about symptoms. So if they're experiencing some kind of pain, try to have them participate in the visit and tell the doctor, or maybe even just point to where they're uncomfortable or where the pain is coming from. For some patients, the next steps after this will be having them start to make their own appointments and to call for their medication refills. And again, at the end, there's going to be a lot of resources that are included, and some of these websites actually have really great scripts that you can practice back and forth with your teen to help them understand, like, what questions should they ask if they're calling to make a medication refill. It's also important to start to review medical consents and documents with them so they understand when you're signing something, what that means, and to start talking about making healthy lifestyle choices. So a lot of adult care is about prevention and trying to maintain the health that we have in our teen and young adult years. And so starting to talk to them about the choices that they make with their diet and their exercise level can be really helpful. So through that process, we're really going to have a better understanding of the decision-making capacity of our teen or young adults. And this is also going to look very different for each family. I think it's really important that we as adults model decision-making for teens and young adults. So if we have our own medical issue going on, it may be helpful to talk with that about them and kind of explain to them the process that we make when we're making a decision about whether we're going to take a new medication or whether we feel like we need to find a new specialist. For some teens and young adults, they may only need informal advice from family and friends. But even in those cases, I find that at least having a release of information on file is really helpful after they turn 18. That release of information would be signed by the teenager, and it would allow you as the caregiver to remain actively involved in their care. So to help them with scheduling appointments, to get lab results, and to be able to help them process that information. I think that that's really critical because I don't know many 18-year-olds who are ready to take over their care independently as soon as that birthday happens. In other instances, we may need something more formal in place, such as a durable medical power of attorney or guardianship. And it's beyond the scope of our talk tonight to go into great detail about these different options, but I do want to highlight a resource that's here called Disability Rights Ohio. They have a wonderful website. They're very involved in advocacy for young adults with disabilities, and they do a great job of explaining the benefits and the downsides of guardianship and some of the other options that are available. One thing that I really want to highlight is that if the formal support is in place, such as a power of attorney or guardianship, it's really important that you have that documentation ready when you're entering a new health system, because they may question or not understand why you as a parent or caregiver wants to be part of a visit or wants to be part of the decision-making process. So having the formal documents with you is just really important and helpful. I am not an expert on insurance coverage and transition plans, but I wanted to really quickly highlight some of the options that are available. With private insurance plans, many youth are eligible to stay on their caregiver's plan until they turn 26. This can be helpful when caregivers can afford to continue paying for a health plan, when that plan covers all of a young adult's healthcare needs, and if a young adult is in the process of waiting for alternative coverage, maintaining that private insurance plan until the new plan is in place can be really beneficial. Private insurance plans may be less helpful in some situations. So especially thinking about when there are financial limitations, it can be hard for families to keep paying those premiums. As an adult gets closer to age 26, we really want to be proactive in finding a replacement plan. There's not a disruption in care that occurs. And also knowing that a lot of kids with complex healthcare needs, that private insurance plan may not cover everything that they need. So thinking about what other cost-effective benefits may be available to them to help supplement. For Medicaid specifically, in most states, including Ohio, adults who qualify for SSI also qualify for Medicaid. But you have to show that your young adult is unable to engage in substantial gainful employment. In some instances, it's possible for an individual to begin working but maintain their Medicaid status, and if they earn less than a certain amount per year. So it's really important to kind of get a lot of information about this as you're exploring different options for your teen or young adult. One other thing that I think is important to know about is that most states, including Ohio, have a buy-in program. So for individuals with a disability who are employed but who are making less than a certain amount of income, they may be able to pay a monthly premium based on income level to maintain their Medicaid status. So these are all just things to kind of know and to look into as you're approaching that transition age, and really just trying to make sure that the insurance coverage never lapses. So now I want to spend a little time talking about what's happening at Akron Children's Hospital with transition. And I will say from the start that this is definitely a work in progress. I have gotten really involved in our transition committee. And one of the things that we find is that across our hospital setting, for a long time, different divisions and different services have been doing transition. So there's a lot of inconsistencies where we've all kind of become siloed and are doing our own thing. So a couple of things to note, current age limits at the hospital. For most outpatient medical services, providers will see patients up until the age of 26. It's really important to check with individual doctors to make sure that the 26 is their age cutoff, because there may be some specialists that try to get their patients transitioned a little earlier than that. A couple of examples that have younger age cutoffs are Children's Home Care, which provides home-based nursing services. They stop serving families when the patient turns 22. And our psychology and psychiatry inpatient and outpatient services stop when a patient turns 18. So that is the youngest cutoff that we have in our organization. And most other areas will be able to see patients beyond the 18 level. We do have a couple of exceptions where adult patients are seen at the hospital. So we have a regional burn center at Akron Children's Hospital that includes adult burn patients. And then we have several specialties. Our work with patients with cystic fibrosis, congenital heart disease, and mitochondrial disease are a few examples of physicians that may maintain their patient connections well into adulthood. So I have had the luck to be part of our Pediatric to Adult Transitions of Healthcare Committee, or PATH. And the purpose of PATH is really to ensure that high quality transitions are occurring for patients who are aging out of Akron Children's Hospital. For our PATH committee include a wide variety of individuals, including nursing, social work, physicians, a parent advisory council member, as well as members from our partner institutions. And our responsibilities have really been to have quality improvement around our transition process and to develop and disseminate a more consistent policy and guidelines about how we're going to transition patients into adult care. this is, as I mentioned, a work in progress, but we've made steps along the way. So we worked on really in 2020 was creating an organizational definition of a high quality transition to really have some benchmarks for how we'll know when we've helped a family have a quite high quality transition. We also wanted to get information from our current physicians and from parents about how transition is working. And so we did some surveys that really helped us see the things that are working well and things that are not working well to help us as we're building a new infrastructure. Currently, we're in the process of trying to create a place in our medical record that will allow for better and more consistent documentation about transition progress. Now, each division is kind of documenting differently. So a patient might be starting the transition process with endocrinology, but not quite ready to start it in nephrology. And that wouldn't really be easily available to know from the medical records. So we're really trying to build something that will let us track patients and families and know where they're at in the transition process. And then an area that I'm really excited about, for our most complex patients, we are trying to develop a more supported and direct path for them to transition to a medical home at Summa Health. And so that's been really a process that we're working out the ins and outs with, but we've had some patients that have successfully transitioned. And I think that's really going to guide our work moving forward. So as I hand over the reins to Julie and Carrie, I really wanted just to highlight the fact that transition is a dynamic and fluid process, and we recognize that it's not necessarily easy, and that there may be things that go really well and things that end up being a little bit more challenging than we would like, ideally. So knowing that there is a care team out there that is willing and ready to answer questions, so knowing that you can reach out to them and ask for help when you need it. And I also just want to recognize that healthcare transition is going to look different for every family. So knowing that tonight is really about getting some tools that will help you through this process, that we're here as resources for you moving forward. And again, I will share my slides that have a bunch of different websites, both for healthcare transition resources as well as some insurance resources. And we will have time for questions at the end. So I'm going to hand it over to Julie and Carrie.
Thank you, Erica. Amy, can you pull up the slides for us, please?
Sorry, yes, just give me a moment. Thank you.
Sure.
Hang in there.
I can go ahead and introduce myself. My name is Carrie Cuomo. I'm a pediatric nurse practitioner at Cleveland Clinic Children's, and I have been working on transition for our organization since about 2014. It's gone through various stages, just like Erica was saying at Akron Children's. It's a work in progress. Julie and I are here to talk about the progress that we've made over the past year, and it's been taking off. It's really gone a lot faster than it has in the previous 6 or 7 years. So next slide, please. We just want to go through the transition definition and look at the work that we have done and things we have developed up until this point, and then open it up for discussion. Next slide, please. So when we talk to anybody at the Cleveland Clinic, we meet with various departments in the pediatric and the adult sides. We have department meetings as we have been proposing this initiative. We like to define transition for everybody so that we're all on the same playing field. The way we define transition is healthcare transition is the process of moving from a child or family-centered model of healthcare to an adult or patient-centered model of healthcare, with or without transferring to a new clinician. It involves planning, transfer, and integration into an adult-centered healthcare. Next slide, please. We at the Cleveland Clinic developed a vision statement. This is what we want to do for patients and their families. And it reads, Cleveland Clinic caregivers will partner with the patients and their families to successfully transition adolescent and young adult patients from pediatric to adult care using a thoughtful, consistent, and coordinated process. Next slide, please. As Erica was mentioning, of the foundation of our program is Got Transition and their 6 core elements approach to healthcare. These 6 steps that you can take to prepare the young adult for their transfer and transition really have been proven to have successful outcomes. The 6 steps are developing a policy or a guide, developing a way to track and monitor their progress, assessing their readiness for transition, developing a specific individualized plan for transition. The actual transfer of care when you would see a new provider doesn't come into play until step 5 along the way. So you can see how much planning goes into it before that actual transfer of care. But then another very important part is number 6, the completion, where we keep the lines of communication open. If that adult provider does have a question about the history of the patient, or there's some unanswered question that they need to reach back, we want to be able to have that communication still open for everybody involved. Next slide, please. So this is our timeline, and we are really thrilled and proud that we were able to keep the motivation going with everybody during the pandemic. We started talking about transition, like I mentioned, back in 2014, but in the end of 2019, we were introduced to a physician who had a initiative that she was working on, and we started planning with her and developed a team to really focus in on transition at the clinic and see if we could bring things forward. So in June of 2020, we had our first meeting. By the next month, we had our healthcare partners focus group. That's parents and young adults who formed to be our consultative panel that we ran all of the work that we were doing through to get their input, to get feedback. And we developed a web page that's within our own healthcare system so that we can have all of our information and tools that we developed in one location so everybody can access them. In August, we launched pilots in 3 of our clinic sites. And by October and November, in August, we identified those sites. By October and November, those pilot sites began working and using some of the tools and the 6 core elements that we had put into place. We've developed the number 1, the position statement, and we are able to attach that in the after visit summaries for every patient in pediatric primary care starting at the age of 14. And that is an introduction. As Erica was saying, it's to make people start thinking about the idea that it's not happening right away, but it is something that we're going to help everybody in the family prepare for and plan for. In December, we developed a website and email that are specific to transition, and we began working with our marketing partners to develop materials that we could use for patients and families. January, we rolled out a second round of pilot office sites, and we had another meeting with our healthcare partners group. And February, we were working on more marketing materials and looking forward again to see what other office locations we can start yet more pilots. Next slide, please. I think that's Julie. Yep, there you go.
Hi. We just wanted to summarize a little bit of some of the projects that we've completed. Carrie alluded to those on the timeline. One of the things that we really felt was important was ensuring that everybody understood that transition is a process. It's not a one-step event that occurs, but it's something that occurs over a period of time. The earlier you start, the more work you can do to gain and ensure success. And so one of the things that we did was we've developed an online education module for all of the caregivers who interact with patients. So at our pilots, we are including individuals such as the front desk staff, the MAs who are rooming the patients, the nursing staff, physicians and advanced practice providers who may be caring for those patients. So everyone who has any type of a patient-facing or role is included in that education and receiving the same information. We also developed a position statement from 3 different perspectives. The first was if a young adult is transitioning from pediatric to adult care. The other option was a young adult who may be being cared for within family medicine and so is not going to move from a different doctor or a different care group, but a different model or way of being cared for. So in other words, when the young adult turns 18, they become primarily responsible for their care. So we want to make sure that we're working up to that milestone and giving them the skills and the knowledge that they need while still staying within that same group with that same provider. And the other position statement that we made was that from the adult side saying, welcome to our practice. Here's what you can expect from our practice and how to reach us, and just a welcome to the group and how it functioned. As Carrie mentioned, we did develop some marketing tools. We wanted to get the word out there that this was something that we were working on. We wanted tools that were directed towards parents so that they started to have the conversation and work with their young adults on some of those skills that they needed. And we also wanted to include young adults directly so that they had an opportunity to also gain some knowledge about transition. We did create a website and we have a link to the Got Transition website. There's a ton of information and a wealth of resources on that site. If you've never been there, I strongly encourage you to go there. They've recently revamped the website. This is their 3.0 version. And the search feature is amazingly robust. If you use the magnifying glass and just type in a word that something that you're interested in. If you want to know readiness assessment for youth with intellectual disability, if you just type in readiness assessment disability, it will direct you to that exact document and that resource. We also developed some tools within our electronic medical record. We realized that we wanted to make sure that that position statement was readily available for everyone throughout the enterprise. And we've started including it in our after visit summaries for all young adults and youth that are 12 years of age and up. Again, not to start necessarily working on specific skills at age 12, introduce the concept that, you know what, we're going to be taking care of you until you're about 18 to 22 years of age. And here's some of the things that we're going to work on as you grow up. And this is going to we'll be with you through a number of years to get you to a successful point. We did also include the readiness assessments in the electronic medical record, and they are great for us, the provider, to look at, because what it does is it shows the readiness assessments over time. We try to get them annually for all youth at well visits, and they are then, the data is stored in a chronologic fashion in a flow sheet, so we can see kind of where the progress is being made and where some of the areas for focus are for the coming year. And we're also working on a readiness assessment that's going to be tailored to youth with intellectual or developmental disabilities so that we can plan for their needs as their 18th birthday approaches. And some of the information that Erica shared was spot on, that we really need to plan for guardianship and some types of supports that might need to be in place with some of these youth. Not to restrict their independence, but to support them and to make sure that all their needs are getting met. Next slide. So this is what our learning module looks like. It's, as I said, a computer-based, and it is one in which you move forward, and it's very interactive. It's much more interactive than some of the other modules that we've done. They did a great job of using some really amazing shots of youth from all different levels of function, and I think, of the 4 pilot sites, everyone who, prior to starting with the pilot, we asked that they complete the learning module. Next slide. This is an example of some of the marketing material and our website. The panel on the left-hand side that says Transition to Adult Care and Overview is the website, the way it appears, and it links to Got Transition, as you can see down below. And there's also a quiz that Got Transition has on their site that kind of helps you get an idea of whether or not your young adult is ready to transition, and some topics that you may want to explore. The middle is going to be on our Scala boards throughout the institution, so that in the enterprise that we get the message to all age groups that transition is something that we're focusing on and encouraging, and want to make sure that everyone has it on their radar. And finally, on the right, we made a tear-off sheet so that we're trying to get away, and a lot of places have gotten away from paper, but I think sometimes it's helpful to be able to hand something to a family so that they have an idea of what the steps are and how to prepare. Next slide. So some of the things that we're still working on and continuing to build, as Carrie mentioned, one of the core elements is making sure that we can track and monitor where young adults are in the transition process. We want to know if possibly it's my patient who may be seeing one of my partners. They want to be able to easily assess where in the stage this young adult would be and what types of topics they would need to address. The readiness assessments are about ready to launch and be uploaded. We have one for the parent, one for the youth, and then, as I mentioned, we're working on one for a parent of a youth with intellectual or developmental disability, so we get an idea of exactly what degree of support they might need as they enter adulthood. We have created and are tweaking the medical summary letter so that there is a portable and computer-based summary of medical needs and providers. And I care for young adults and children in pediatric complex care, and we've created a complex medical summary letter, not only for transition, but we use this kind of also as an emergency medical care document, so that if they're traveling, they can have this not only in paper, but also available to them via MyChart. And one of the other things that I'm most excited about, which we're not yet, we're working on getting this going, is to develop a micro-learning module for our young adults to gain experience and knowledge about transition. There's only so much time in a visit with the young adult. So this is a computer-based interactive learning module for young adults to see how many different of the skills they've mastered and where they might need some additional help. The pilots that are currently underway, in 2020, we started one with Gen Peds located at main campus, transitioning to internal medicine at main campus, pediatric to adult asthma, and young adults with cerebral palsy who are cared for at our Cleveland Clinic Children's Hospital for Rehabilitation, going over to adult physiatry and rehab. First quarter of 21, we're getting ready to launch the spina bifida group, the young adults to adult transition and care, nephrology and transplant, peds to adult, and Beechwood primary care, pediatrics to adult. Next slide. And that is pretty much all we have formally to present, and I'd love to hear your questions and comments and offer any other information that we can.
Thank you, Julie, Carrie, and Erica. At this point, we really have, several minutes, the next half hour plus, to really get into some great discussion and questions from the participants. So we encourage everybody to ask away, make good use of all these experts' time. For me, it's so exciting to hear about what Akron Children's continues to learn or continues to work on with SUMA. That's really great. We heard that from you about a year and a half ago too, Erica. That's wonderful. And the Cleveland Clinic, this is just an amazing new resource, and the materials and the online module for the young adults. Oh my goodness, that's really, really, really exciting. So we're anxious to get to the chat box now, and I'll let Lori and Wendy take it from here. And she'll read them aloud and call them out as you get them then, Wendy and Lori. Thank you.
Okay, I'll read the first one. Right now, our son's pediatrician is with UH. All of his other doctors are with the Cleveland Clinic. Would it be best to get him an adult primary care physician with the clinic?
That's a great question. And I think that Erica and we share Epic. So the communication between hospitals that do have Epic, there's something called Care Everywhere. And so it does enhance communication in that regard. UH is on a different medical record called Cerner, and there isn't a direct communication between the two. I think that it's a personal choice, but either Metro also uses Epic. It would probably enhance, especially if you have a young adult with some complex medical needs, to have that primary care reside in the same place that the subspecialists are. And I will stop there. And Erica, I'm interested in hearing what your thoughts are too, and Carrie.
No, I would agree with that. I think that Care Everywhere is great and does allow for like more communication, but I know even internally, I think I have more access to things within Akron Children's than I do through Care Everywhere. So I think it just makes it easier for physicians to really communicate and collaborate on a care plan if they're within the same organization. And I will say, like, it doesn't always work out that way, that sometimes there might be a specialist that you have to see that's at a different organization. But I think having the primary care and the majority of specialists at the same place is probably just helpful, I think.
Yeah, my only thought was depending on the age of the child, because we don't know, like if your child's 17, you could stay with the pediatrician and work on converting some of the subspecialty providers over to adult care, and then transfer that primary care last piece out of the equation. It just, as they both said already, it's very patient dependent, but if they're younger, I would probably agree that just for communication purposes, it's easier to be all within one system.
Thank you.
We have another question. Are these readiness evaluations available to non-Cleveland Clinic or to non-Cleveland Clinic docs to be used in Epic?
Yeah, so not the ones that we put into Epic. So we had to build those ourselves. However, we built them right off of the GOT transition readiness assessments. And so you could print them out and give them out on paper, which is how we started several years ago. We printed them out on paper. And it was fairly easy. We just had an IT specialist, one of the Epic specialists at our hospital, who took the GOT transition readiness assessment and made it into a questionnaire. We decided to make it a questionnaire in EPIC, if you're working on EPIC right now, whoever asked the question. And that way, as Julie had mentioned before, the answers go into a flow sheet, and then you can track it year after year and see how the progression goes. So that's why we built it that way.
We're hoping to have those built so that they're sent out prior to the well visit appointment via MyChart, so that some of that information can be obtained prior to the appointment, so that it doesn't delay, spending the first half of the appointment by filling out forms and gathering that information when they're rooming the patient.
I'm so glad you mentioned that. We've been kind of in the process of trying to build out our EPICS part also, but I know that a lot of providers have had like hesitance about being able to do the whole readiness assessment in a visit. So the idea of using MyChart as a pre-visit, that's a great idea.
We're actually exploring too, and I don't know if I should be giving our secrets away, Erica. We're for the new readiness assessment, we're going to be giving it to the adolescents in segments. So maybe 5 questions at a time. And if they master those 5 questions, then they'll move on to the next 5 questions. So it's not so overwhelming. Right now, if for the families that are on the call, if you looked at the readiness assessment, it's about 25 questions or so. It's a full sheet of paper on one side. And it does take a little bit of time to fill out. And so that is one of the things that we heard from our providers and from the families, is that that's a lot. So if we can break it up into little pieces, that's what we're doing next.
Okay, next question. As a services and support administrator with the county, what approach would you like for us to take about mentioning you in transitioning to adult care?
I guess you could mention that we do have information available on the website. So it's not just information that it would only be available to the Cleveland Clinic population, but there's information on our website. And again, GOT Transition is a huge wealth of information for both parents and young adults. It has information for subspecialty providers, for general practitioners, for parents. There's a toolkit. There's implementation guides for launching a transition program within your practice. It's really a wealth of information. I guess what you could mention with regard to the Cleveland Clinic is that we are working to, as an enterprise, to try to prioritize this and work on transition for everyone, so that we are caring for young adults, children, all the way into adulthood. It's been one of the initiatives that has been given kind of top booking within the clinic.
I would say from an Akron Children's perspective, and really for any healthcare system, I think just encouraging families to start the conversation. I think historically, there has been some fear on the provider side that like starting to talk about this may make families too anxious and that they kind of avoid it a little bit. So I think to shift the culture at Children's to where it becomes just part of the conversation, that we start it early on, and that it's okay to talk about it, that it's not a scary thing. But sometimes having families initiate that conversation may actually make it easier to get the ball rolling.
The next question is, my son just turned 18, but the transition information is new to me. What should I do first? And I know that's a question a lot of people have.
Yeah, I would say the first thing to do is go to gottransition.org, and there's a quiz that your son can take, and it says, am I ready for transition? And it's a series of questions that go through, and then it has ideas and suggestions for how to go the next steps after that. That would be my first step.
And luckily, I think at most institutions, so with the exception at Akron Children's of behavioral health with like psychology treatment, most institutions I don't think are going to have like a push you out the door at 18 rule. So I think luckily there's definitely some wiggle room and some time to kind of make plans, and don't feel like just because you've hit that 18 mark that it's it's has to happen tomorrow. I think there's still time for it to be kind of a work in progress.
Absolutely. Most of our primary care offices see patients up until 21, 22. So there's definitely time. Just like Erica was mentioning before, that your learning curve is just going to be a little bit more condensed, but all of the same steps can be, completed within a couple of years.
Okay, thanks. We have one comment and then I'll send another question. I have heard that UH is planning to move to Epic, is the comment. And then the question is the medical summary completed by the doctor or the caregiver?
Our medical summaries are completed by the providers, the doctors or nurse practitioners. We also elicit information from the family. So for some of my patients in complex care, there are some nuances, things that are good tips to know, like please don't come walking in a white coat, or different things that might trigger a young adult or teen to have a more stressful response to a new provider. And so that information we try to include in our medical summaries also, or from a practice base, if it's a respiratory issue that responds well to X, Y, and Z treatment, or other type of medical situations that tend to commonly occur, we try to include that in there so that there's an easy way for that new provider to look and see, oh, okay, we need to try this instead of this medication. And especially if you're traveling or if you're presenting to an emergency room, that there may not be someone there that knows your child.
Right, thank you. We'll move to the next question. Are there certain primary care providers who do well with adults on the autism spectrum at UH or the Cleveland Clinic?
I can't really speak to UH. I can tell you that at the clinic, yes, we're working on trying to identify those practices who have providers as well as support staff that are trained and they have a different approach, and they may have a different way of rooming a patient so that young adults with some behavioral issues might be anticipated and prevented from worsening. I've worked on a committee with a physician by the name of Dr. Carl Tyler, who takes care of adults with Down syndrome and also those with intellectual disability. And he's put together a kind of like a single sheet tips and tricks for managing young adults with autism or behavioral issues and concerns, and trying to distribute that throughout the Cleveland Clinic, and working with some other community agencies to try to come up with some supports for those type situations. We have a pediatric comfort care team, which is our child life specialists and some of the MAs and nurses who have come together and put together educational sessions for comfort techniques for holding young patients when they're getting an injection or a blood draw, and using distraction, using some other techniques to desensitize or to decrease pain when giving an injection or drawing blood. And we're trying to work to expand that to the adult side so that some of our adult colleagues are also well-versed in those types of techniques. And that's on the horizon. It's not yet been fully recognized, but we do recognize that there's definitely a need.
This next question is along the same lines as the last one. My son is nonverbal autistic, age 14. He is very aggressive with any medical specialist. His current pediatrician and his staff are trained so that they can handle him. However, how would I even go about finding an adult provider when he turns 18?
That's another great question. Erica, why don't you help us with that?
I think that this is something that we've talked about. The hospital is trying to be more proactive in providing some education opportunities for the adult facilities that are close by to us. But I really think in this situation, especially, that communication between the pediatrician and the future adult provider is going to be so hugely important. So just that medical summary is not going to be enough. They're going to need to have some conversations. And I think in an ideal world, what we would love to see is to actually have there be a way for the adult provider to meet your child before the first visit, so that they're at least a little bit more familiar. Unfortunately, sometimes with time constraints, that becomes a little hard, but I actually think that all the new telehealth technology is going to help make that more possible, so that there can be like these meet and greets that happen that hopefully it may not alleviate the stress of that first visit, but may make it a little bit more of a gradual transition. But I think all of the things that your pediatrician knows about your child so well, those are the things that we want to be communicated before the transition would happen. And so that starting early piece, I think, really helps that to happen. But I think we all recognize, I've heard from families like really scary things that happen at the ER, or different situations where like the new medical team just doesn't know all of the things that help make a child feel comfortable. And so, or young adult, I'm such a pediatric focused person that I keep saying child, but that help make a young adult feel more confident and comfortable in a new setting. So it's definitely something that I think just in general, we all need to do better at in the medical field. And I think we recognize that, but it may take a little time for that to be consistent. I think one other thing that I'll add there, I get the impression from the new residents that are coming through and the new trainees that they're getting a lot more focus on development and developmental disabilities in their training. And so I hope too that it kind of shifts the mindset, and that the new physicians that we have coming up through the ranks like know a little bit more about autism and about intellectual disability. I think at least at our hospital, that's really a focus of any resident that comes through the clinic. They do a rotation with developmental behavioral pediatrics and get a lot of exposure. So hopefully if they are kind of in a med peds program where they're going to be doing some adult care or are doing just a pediatric rotation through their adult program, hopefully we're providing them with more knowledge about these special populations.
The next question is a little bit more Cleveland Clinic oriented. My son is 18 and all of his doctors with the Cleveland Clinic, we are having trouble finding a Cleveland Clinic primary care doctor. Given his advanced needs, our pediatrician just retired. How should we find a family doctor that will best suit my son's specific needs?
I would tell you, I just put our email, the transition email in the chat, and email us. Julie and I are the ones that navigate that. And if you're willing to share your son's medical record number with us, we can help navigate that for you. That's the idea of our clinic that we're developing with Julie's panel and with me. Our vision is to have a consult clinic, if you will, so that families that have a hard time with more complex navigational needs, that we can be those experts that help you find the right place to land.
And we've had a great, this most recent project that we've started over the last year has brought a wealth of individuals from both the adult and the ped side together. Prior to this, for many years, it was just one-sided, from pediatrics trying to find, a way to get someone to the adult side. Now we actually have people coming together at the same table saying, let's work to make this a smooth transition. And we have people that have also come that say, I am really interested in taking care of young adults with medical complexity and intellectual disability. I have a number of physicians that are on our subgroup, which is for young adults with medical complexity, and they have a desire to take care of these types of patients. And I think that's the important part, not only just finding somebody that they could go to within the same practice, but somebody who wants to care for them. And we're also trying to set them up for success by also enhancing the supports that they have in their office. So possibly having a social worker or a nutritionist or a pharmacist that can assist with that population and all of their complex needs. So yes, please reach out if you're okay with sharing some contact information. We'll definitely reach back out and see if we can help you navigate it.
Okay, next question. As a hospital, how soon in your development of the transition program did you start placing the marketing tear-off sheets that say, is your child ready to transition to adult care? Should Akron Children's wait until the transition program is farther along or start the marketing early? I am on the transition committee and I'm interested in how Cleveland Clinic did it.
Yeah, so we did it at about the same time that we started the pilot location. So we, as soon as we had those developed and we had the caregivers all take that education module, so they all knew about what transition was, that's when we placed those tear-off sheets in the offices. And right now, there's only the 3 pilot locations that have them, but the next group is rolling out, and they're actually nice for us to have as we start talking to new sites about the program, because it's an easy bulleted graphic that it's easy to look at visually, and you can understand that there's a process, that it's not a quick, we're gonna, you know, start everybody at 18 and they'll be in a new place at 19, that you can see that it's a span of 12 to 22. We're talking 10 years of planning, organizing, educating, and customizing for each individual. So we did it as soon as they were printed for us.
The position statement that talks about transition, saying that we're here to help you and we're going to work, it auto-populates now on all the after visit summaries starting at age 12. We're starting the readiness assessments annually at age 14, but the concept gets communicated at age 12. And I think, again, like the earlier the better, if we can get that information out there so that it also demystifies it a little bit and makes it not such a foreboding thing. It's kind of like graduating from school or getting your driver's license or doing all of those other activities of growing up into becoming a young adult. It's just part of that process.
And we don't have all the official pieces in place yet of our full program. We're still working on a dashboard for tracking. We have desires for what our end product to look like that education for the adolescents. You know, that is our dream, to have this micro learning, and even the most current version of the readiness assessments that's going to give them in chunks. We don't have that in the computer yet, but I don't want you to wait. The faster you can get it out to everybody, I would say the better.
Thank you. The next question is, did I miss the link to get the Cleveland Clinic questionnaire version of the GOT readiness assessment? Is there a link that we could share in the chat box for that?
It's just the GOT transition readiness assessment. I can pull it up real quick. I will get the link and I'll put it right to the readiness assessment. I'll put it in the chat.
Thank you.
The one thing about GOT transition, for those of you who are on committees that are talking about it's meant to be customized and individualized. It's not a copyrighted site. They want you to, put your logo on it and to use their information. It's really meant to be a resource for all.
Okay, next, and I think it's more of a comment. Just a note, my son will be 18 in a few months and his pediatrician is retiring. He and Milestones has been very helpful identifying adult providers for his transition. We have not chosen a new physician yet, but we have a place to start.
Yeah, I would highlight Milestones is an amazing resource. Like the searchable database that they have, they just have so much information that I recommend that a lot to families.
And then I'll just read the next question. My child has leukodystrophy, neurological, behavioral, and developmental issues. Her care has mostly been centrally managed by her pediatric neurologist. Should we be looking for a GP to manage or an adult neurologist?
I have a bias on this. I work with another provider, and we are a patient-centered medical home for young adults with complex medical conditions. We are their primary care. And I feel that it's important to have a hub on the wheel and somebody overseeing the specialists and different specialists and making sure that to help you navigate and ensure that your child is following through on things as recommended. So I am biased in saying that I think, yes, having a general practitioner, whether that be internal med, family med, or pediatric to adult, is really important.
I agree. I think there are certain things that as adolescents, young adults get older, that those general practitioners are trained to know about, whether it's diabetes, whether it's, I can't even think of all the adult things that we have, that they screen us for. Think about, help me, Julie, what's an adult? We don't do adults, so I'm trying to think of things.
I actually had my doctor's appointment tonight.
High cholesterol, right?
My last mammogram, my last
Yeah.
colonoscopy, when, lab work, vitamin D, bone health. Medicine and science has done an amazing job of taking care of kids who never would have survived into adulthood, and they're having wonderful, wonderful lives and many long lives. And those are all things that I rely on my doctor to help manage and guide me through, because that's not within my scope of practice or my knowledge base to keep up on all of that stuff. So I think that, yeah, someone who has the ability to oversee all of the different aspects of that person's care, as well as communicate with those providers. I think the communication part for our team is really paramount. That's one responsibility that I take on myself. If I see something that maybe that neurologist needs to know about, it's my job to make sure that I communicate and reach out to that subspecialist so that we can both work together to partner on caring for that patient. Those are amazing questions. You guys are really coming up with things that are really thought out and making us think too.
Oh, we have another question about finding a dentist.
Yeah.
I know that's always been a very big, finding an adult dentist for our children or young adults or our adults.
So right now, it's challenging for finding dentists for kids also who aren't able to necessarily cooperate with an oral exam and cleaning. Sometimes it requires some sedation to do a good exam. And we are trying to work on that and work with our partners at the Case Dental School. Metro right now has a wonderful dental program, and oftentimes we're limited also by insurance and where they dictate that some of their clients go. What we try to appeal for are young adults that are or kids that are undergoing general anesthesia for a bronchoscopy or for an MRI or some other procedure, and try to tag on dentistry under that same anesthesia. If you send us a message on the transition email site that Carrie put in the chat, I have a list of providers, both East and West Side, that are typically better with young adults that have some challenges. And whenever anybody says they have a dentist, I say, who is it? And I put them down on my list because that is a real tricky thing to navigate.
Okay, next question. My son is 18. He will be 19 this year. We did guardianship. He is nonverbal, CP, anoxic brain damage, seizures. We mainly see his doctors in Akron's pediatric neuroscience. He does have a primary care doctor through Akron Pediatrics. My question is, where do I start to look for an adult primary doc?
Do you want to, Erica, are you able to talk a little bit about how your PATH program sounds like might be helpful?
Yeah, I think that we are process of kind of trying to create relationships. One of the things that is in the works is that SUMA is developing a complex care clinic. So as part of their work with our patients, they're kind of expanding that program. And so that may be a place to start, is kind of contacting SUMA to kind of find out a little bit more information about their program. I also families to talk with your current specialty care providers to see if they know of anybody that they have a good relationship with, that they could communicate information with, because they may know of a resource that we're not even aware of. So I think that can be helpful. And also the other thing is about insurance coverage. I hear sometimes from families that it can be a little bit more difficult depending on the type of insurance you have to find the right providers in the adult setting. So just making sure that you're checking whatever your insurance coverage is and kind of seeing who in the area is an adult provider that's on the plan. One other thing that I do think sometimes when we're thinking about family medicine doctors, or doctors that may have a practice that spans a bigger generation gap, so maybe they see kids and adults, sometimes I find that they have really good understanding of different developmental levels and can kind of adjust the way that they talk and present information a little more easy than the folks that just see adult patients. So that could be another factor to consider, is thinking about family medicine rather than just an adult PCP. Really quick, Wendy asked me in the chat to pull up the Got Transition website, just so that anybody that's still on the call can kind of see what it looks like. And so one of the really helpful things is that it has a lot of information about all the 6 core elements that Carrie and Julie presented. It has a section that's specifically developed for youth and young adults, and then also has a section that's specifically for parent and caregivers. And so this really has a nice just overview of a lot of information. And it has links to examples of the readiness assessment, examples of the different educational materials about outlining the differences between adult and pediatric care. So there's tons of handouts and resources. I think that the new design has made it easier to navigate and a little less overwhelming, but it's still a lot of information. So don't feel like the first time you go on that you have to look at everything. It can be kind of a check it out when you have a few minutes and then plan to come back to it later on.
The one thing on the site, so where the magnifying glass is, we actually kind of looked over the site before it launched. They really tried to make that a robust search feature, so that if you just type in a couple of words for what you're looking for, and it will take you right to the area.
And there are so many resources. I joke with Julie, and she's probably heard me say it 100 times. Every time I go to this website, I find something new. I love spending time exploring and seeing what they add. They're always adding new articles. There's videos, there's lectures, continuing education. There's all sorts of things available to just about everybody who would be on this call, and then some. It's just every subspecialty. It's awesome.
Any more questions for the speakers tonight? Wonderful presentation. We're really glad you all could join us this evening. It looks like for the most part, we are done. We want to thank the speakers, Carrie, Julie, Erica. You guys rock. You're awesome. Wealth of knowledge. We're really lucky to have you all here in the Cleveland area supporting all of our kids and adults, young adults, families, etc. It's a pleasure to work with you all. Folks, don't forget this webinar is being recorded and will be archived on our website, ohiof2f.org. Please take a few moments, complete the evaluation survey, and we will call it a night. Thank you. Have a great rest of your evening. The slides definitely will be available also on our website. Yes, indeed.
Thanks.
Thank you all.
Thank you.
Thank you.
Thank you.